I think because it gives you an opportunity every day to try and help people along their journey, to help them achieve their goals. And I think that's something that we do really well as a clinic here. So I grew up in Cranbourne here in Melbourne. I trained to be a physio at Trobe Uni in Bundoora. I did my undergrad there. I did my master's in sports physio there, and I did my PhD there as well. So, and I now work there as well. So, I think I'm very much a La Trobe graduate, and I would say I'm pretty proud of that. I think it gave me a really good training. Yeah, I think for a long time I sort of did everything, and I think that gave me a really good grounding as a physio. I think probably in more recent years I've specialised, particularly around the hip joint, because that was part of my research training, but also really anything lower limb, I would say. So hip joint and sort of complex lower limb joint pain is probably what I see predominantly now. Yeah, so as I said, did my PhD, finished in 2022. My PhD research was around looking at symptom severity in people with young adults with hip pain, and looking at the relationship between their bone structure, so the way their bones form around their hip joint, and how that relates to their symptoms, but also how the way they move relates to their symptoms as well. And so I think my PhD really gave me some really good clinical skills to bring that back to patients, to both help them understand the way their bone shape might influence the symptoms that they have around their hip joint, but also the way that they move. And that's probably, from a physio perspective, something that gives us a real avenue to help people and make their symptoms feel better. Yeah, so I still work at La Trobe doing research. I do research probably 3 days a week. I also teach the next generation of physios a couple of days a week, and obviously work here at Complete. My research from a hip point of view is looking at treatments for hip osteoarthritis, and really also intervening before people get to the point of having hip osteoarthritis. So looking at younger people who are at risk of developing that in the future, and looking for interventions that can help to either prevent or delay or slow that progression of osteoarthritis. So I think it has the potential to make a really big impact in people's lives. Like every good physio day, we're just injured adolescent athletes that never quite made it, right? Yeah, so certainly. So I think I enjoyed playing football when I was younger. I had a dislocated patella. I had hip and groin pain as an adolescent athlete as well. So I was, one of the 50% of the football players who develop hip and groin pain. So I was in that category. I think probably what it taught me is that physio has a really strong role in helping me get back to the things that I really enjoyed. And it showed me that, perseverance and sticking to that course and addressing the impairments that we found as part of that physio process was something that gave me really clear direction to get back to what I really wanted to do. And I think that what that taught me is, as a physio, to be really specific to the needs of our patients. And while as a physio I can identify things that I think might be important for that patient, actually sitting down with the patient and saying, what is the number one thing that you want to get out of this, and how do I help you achieve that? So I think that as being on the other side and being a patient, you kind of, it helps you to understand as a physio how to really meet patients for their goals and meet where they're going. So I have 3 little kids, Dave, and so that consumes a lot of my time. But outside of that, I like to do a little bit of running. Probably I'm not as fanatical about running as some of my patients and some of the guys here at the clinic. But really just getting out, going for a walk we've got a couple of dogs and my wife, and just spending time out in nature and just going on some walks. We live really close to a flora and fauna reserve, so it's really nice to sort of get out and go for a walk and go for a ride through there. I like to play golf, but unfortunately my children have impacted my free time to play golf. I like to actually garden. We have a bit of land where we live now, which is great, and we've got chickens and a couple of dogs, like I said. So I like to get out and garden and just get out in nature, really, and try and unwind from the stress of research and teaching and just the busyness of life. Yeah, I've been here a long time now, Dave. So I started way back, probably 10 years ago at least now. And I've always loved the underpinning of evidence within our clinical practice. And I think that was part of the reason why I ended up doing my PhD. I was inspired by the people that I worked with, and how important it was to inform our practice with the best and most up-to-date evidence that we do have. And it sort of instilled in me the challenge to be the best physio that I can be. And that's why I really like working here, because I'm always pushing to make sure that I'm doing the best for my patients. And I think that's a really strong point of what we do really well here at Complete.